Hello everyone, to anyone watching this. This is my chosen source for my research topic from the JSTOR. The name is The Rescuer, a petition or resolution of Victorian women's conflicts by Ilan L. Basouk. So, this source is actually a very quite interesting source. Probably my favorite one that I have researched so far. This talks about the rescue and how it was developed and when it was developed and how it worked and how it went popular. So the source starts with acknowledging that every treatment has its time has its period of time. So the source starts with a condition of a woman that was severe and that the rescuer did help her, and that was only one case of many cases. And this um, this treatment got so popular and it was used in every medical field, which means that every woman diagnosed with any problem they would use the rescue. And of course, this worsened a lot. This worsened every woman a lot because not every woman needs to rest. Not every woman's diagnosis should be rest. And this is because of the assumption of male doctors saying that every disease of a woman is probably just nervousness, or with hormones, or emotional. So they treat every woman with the rescue. And here, the next pages talk about what the rescue is. For a brief summary, the rescue is basically, in his time, in 1872, by S. Wire Mitchell, he developed the rescue, and he treated his patients, saying that they're going to get a positive cure, and that by him taking everything up, I'm talking letting them not do anything, not even sit, giving them orders to sit, how to sit, or ordering them to not read or do anything that will move your body in any way, or you can't even read, like you can't even challenge yourself in any way. You need to rest in bed and let yourself heal. This is almost like a confinement, and this really affected women at this particular time. So he ordered complete rest, and here he gives examples like for example, well, I can't find it now, but he says, like, for example, I order them to sit, not read, and before the rescue happens, they should promise that they will not have any will to cry, any will to challenge him, which is Mitchell, and anything. So to relate this article or source to my research paper, I am researching about benevolent and medical sexism, and I'm comparing it to the Yellow Wallpaper. So the Yellow Wallpaper, if you know, is a story, very straightforward, that talks about the main character and how she perceived her care. So the Yellow Wallpaper, she was confined after getting a baby, and she was treated with the rescue. This perfectly aligns with this because it really shows how her results, how her results, how her conditions led to her results. As you know, she was whipping the yellow paper and she went kind of crazy, and it really relates to it because there are reasons why these women go crazy, why these things happen because of medical sexism. Medical sexism. Men are women almost feel inferior to men. For example, the John the her doctor, not her doctor, her husband, for example, he tells her to stay in all the time and everything. But why? He says that because he thinks, because of his past, because he's a physician, because he's more educated or whatever. She thinks that because of that he knows what's best for her. He knows what's good for her, and she agrees with him. So it almost makes women not. It makes women like it makes them not think for themselves anymore. They can't think for themselves because of the men's because of the men. For example, here, um, Victorian women were taught to view themselves as inferior to and dependent on men. This relates exactly to one portion of my research paper, which is gender roles and how the medical field is very sexist when it comes to men and women. For example, all women's gynecologists are men. People who don't even have the same bodies tend to make decisions on women, and these women don't even cannot even relate to them, nor can the men relate to them. Um, so this is how this source relates to my research paper. And one question I would like to ask to anyone watching this is: do you think men are the take the most responsibility in women's diagnosis? And if so, how do they how do they undermine women's capabilities, which results to women having these traumatic experiences like the one we see in the yellow wallpaper. I hope you enjoyed my video. Thank you for watching.